saying earlier about the oral microbiome within the mouth, there exists the largest colony of bacteria that is, that is within the body itself. The largest number of bacteria, I think, is over 400 species of bacteria that's found inside the mouth. And so, if there is an imbalance in the bacteria, sometimes, and specifically clinical data with some surgeries, we find that the bacteria that is expressed in the mouth is found within some regions. For example, there's a close relationship between the heart and the mouth, and the bacteria that is found in, for example, patients that experience endocarditis or have any history of endocarditis. Those patients, for example, if we're gonna do any, even just a regular dental cleaning, we have to.
That's a big word, doc. You
It
can just
is an inflammation of the inside muscles of the heart. So if
okay.
they experience any form of infective inflammation of the inside muscles of the heart, research has shown that those bacteria are definitely associated with the bacteria that is found inside the mouth. And
Wow.
so, in the event that we have patients who have any history of endocarditis, we have to prescribe antibiotics for them, a high dose of antibiotics for them before any form of dental intervention. Also, for patients who have done any joint replacement surgeries within the past 6 months, they have to get clearance from their doctor first. Plus, we have to prescribe antibiotic prophylaxis because they find that the bacteria that is found inside the mouth, if any intervention is done, it causes an infection in that area where the replacement is done in the joint. Um, so, okay, yes, with diabetes, there is a bilateral relationship between diabetes and the oral health. Diabetes can worsen if the patient has periodontal disease, it can worsen the periodontal disease, and vice versa. The periodontal disease can worsen the diabetes, because in diabetes, uncontrolled diabetes, I should say, there is an uncontrolled amount of sugars, basically, that is, lying around in the blood. And so the red blood cells, these sugars, they attach to the red blood cells, and it causes a change in the walls of the blood vessels, and it therefore affects every organ in the body that has very small blood vessels, and your mouth is one of those places in the body that has small blood vessels. The retina, that's why sometimes I find that patients who have uncontrolled diabetes might end up with kidney disease because of the small blood vessels that are found in these regions. The extremities of limbs, like the fingers and the toes and so on. So that is the reason.